Hello, this is Caleb Smith with the Rocket Miner newspaper with your regular coronavirus or COVID-19 update for April 2nd, 2020. According to numbers kept by Johns Hopkins University, worldwide, there are now more than 1 million cases of coronavirus, and there have been more than 50,000 deaths. Now, these same numbers note that there have been more than 200,000 people who have contracted the virus and recovered. In the United States, more than 240,000 people have been infected, or almost 250,000 confirmed cases, with the death toll topping 5,800 people, or 5,800 people. In addition to the impact of the virus itself and the steps that are being taken to kind of wind things down and hunker down in society, there's been an economic impact. Today it was announced that in the United States that there are about 10 million people who've applied for unemployment. That includes 6.6 million new unemployment claims from this past week, which about doubled last week's 3.3 million claims. Right now in Wyoming, as of about 5 p.m. it's Thursday, there were 153 confirmed cases of the coronavirus. The breakdown as provided by the Department of Health includes 3 in Albany County, 6 in Campbell County, 3 in Carbon County, and 3 in Converse County, 26 in Fremont County, 1 in Goshen County, 8 in Johnson County, 37 in Laramie County, which is the largest concentration reported in the state, 19 in Natrona County, 1 in Park County, 10 in Sheridan County, 1 in Sublette County, 3 in Sweetwater County, 29 in Teton County, 1 in Uinta County, and 2 in Washakie County, for a grand total of 153. It's noted that right now Wyoming is the only state without a death that has been attributed to the coronavirus. Looking at Sweetwater County, as we said, there are 3 cases reported. The third case, that of a young child, came just after Hannah Romero taped Wednesday's video. Officials note that the first confirmed case of coronavirus in Sweetwater County, a man in his 40s who lives in Green River, is now reported to be fully recovered and has returned to work. The second confirmed positive case in Sweetwater County, another man in his 20s who is also from Green River, is said to be in quarantine in good condition with only mild symptoms that are treatable from home. That third case that we mentioned, a young child, is also in good condition with mild symptoms that are treatable at home. The Sweetwater County COVID-19 Emergency Operations Command released a list of some commonly asked questions and answers, of which I'm going to share a few with you. One is, what contingency plans are in place in the event that Memorial Hospital Sweetwater County is overwhelmed with COVID-19 patients? Memorial Hospital of Sweetwater County is actively working with both the Aspen Mountain Medical Center and Castle Rock Medical Center to not only address potential overflow from COVID-19 patients, but also for regular and continuing patient care needs and treatment. When it comes to other locations that are being considered, Western Wyoming Community College has offered the use of one of its dormitory buildings as a possible treatment or housing facility. The EOC is also working with other local healthcare providers to identify potential facilities for triage and or treatment. They note that we are lucky to have a number of alternatives in our county, such as the Sweetwater Events Complex, Wyoming National Guard Armory, in addition to a variety of privately owned and operated community health and medical clinics. Late last week, it was announced that there are 11 ventilators present in Sweetwater County. When asked what is being done to locate additional ventilators, if necessary, officials note that there is already a supply chain in place that allows Sweetwater County Emergency Management and Sweetwater County Community Nursing working in coordination with their counterpart agencies at the state level, to receive critical equipment and supplies from the Strategic National Stockpile. That's a collection of equipment kept by the federal government, which includes ventilators, personal protective equipment, PPEs, that type of thing. To date, Sweetwater County has received a bulk equipment of PPEs from the Strategic National Stockpile, and will soon receive a bulk shipment of hand sanitizer. When supplies comes in, like face masks, gloves, that type of thing, they are distributed locally by Sweetwater County Emergency Management and County Public Health. We're being asked what is done, or what is in the process of being done to identify additional personnel, once again, if needed. The county notes that right now they're working on avoiding exposures and infections to those who are currently working on the front lines. Our doctors, our nurses, our emergency medical services, firefighters, law enforcement, physicians. To do that, they are continuing to distribute the PPE supplies to ensure that they have the, quote, safety equipment that they need to continue to safely do their jobs and serve the public during this crisis, end quote. They're also working to draw from other local providers as well as contact reserve and or recently retired personnel. Of course, they note that the best way to address the need for additional personnel is to not need them. And that is to remind all of us to be doing our part to flatten the curve, limit the spread. The advice remains pretty much the same common sense stuff we've been hearing for some time now. Practice distancing between other people. Try to limit to contact of just those in your household as much as is possible. Please only go outside or out in the community for the absolute necessary things, such as groceries, gas. If you are out and about, please keep your distance. Please take advantage of the wide open spaces that are easily available to us. There are those who are in some highly concentrated urban areas right now that would all but kill to be able to jump in their car, drive 5 minutes, and be far removed and out of sight of another single person. We have that. We can take advantage of that while we can. In addition, please keep washing your hands for at least 20 seconds with hot water and soap. If you don't have soap, please have something that has a very high concentration of alcohol in it to clean and disinfect. Keep your eye on surfaces. Avoid touching them when you can, or clean them. It's been noticed that it's like somebody sneezes on it or has it on their hands and touches it. The virus can linger on surfaces for, and it varies amount of time depending on what the surface is and what's been left behind. Please practice lots of cleaning. I'd also encourage that you apply positive peer pressure to our friends and neighbors to encourage them to make responsible, safe, healthy decisions for themselves and the community. Please also share tips with one another, so it might be, here's a craft that we came up with to help keep the kids out of our hair. Let me just give you 5 minutes to vent about that in-law, and you know the one. Just to get it out, so let me say it to you so I don't say it to that person. Whether it's watch this clip, it's hilarious, watch this movie, it'll take your mind off things. Here's my advice for breathing exercises or physical exercises, of which I need to be doing more. Whatever it takes to help us when we can to bear the burden of one another, to help us every so often just take a little bit off our shoulders. Because we're all in this together. Wyoming remains the only state that has not had its recorded death. And it would be wonderful if we would get to the end of this current season with that record intact. If that is not possible, we should still be doing whatever we can to keep that number as absolutely low as we can. By doing right by our neighbors, doing right by ourselves. Part of that's being informed. And that's why I invite you to keep looking to the Rocket Miner through these videos, through our online edition, through our upcoming print edition this Saturday. This has been Caleb Smith with the Rocket Miner newspaper, wishing you a good night and a safe tomorrow.